Hey, it's Johnny Jet. Welcome back to my podcast. Today we have Meredith Butler, who is a friend of one of my good friends. And she, I found out, just recently went to the Bahamas and tested positive for COVID. So we're going to talk about what it was like getting COVID while you're on vacation and also this unique way of transporting. I mean, because she was at this resort. Actually, why don't I just let Meredith do the talking because no one wants to hear me anyway. Meredith, welcome to my show and thank you for taking the time.
Thank you, Johnny. Yes, it was a very exciting experience in the Bahamas.
So you are a nurse in New York City.
Yes, I am.
And by the way, what kind of nurse are you?
Postpartum and NICU nurse.
Oh, wow. Wow. So thank you for your work there. I mean, what's it been like there? Is it all your friends or colleagues out with COVID?
Currently, yes, we have a lot of people in quarantine, so staffing has been really short. It's been very busy, but we powered through the first wave, so we're powering through this.
All right. And so you were on vacation. Was it Christmas? When were you there?
It was Christmas. So a couple years ago, we started going on vacation Christmas somewhere warm. And I actually wasn't involved. I went with my mom and my sister and my aunt. And they picked my mom planned the whole thing. She picked the destination. And when we planned it, things with COVID were a little bit more under control. Everyone had just been vaccinated. And it was funny, right before we left, I've been tested a million times. I'm exposed at work all the time. And I said, well, what's our plan? If we test positive while we're there, we should probably come up with it. And my sister had taken over a lot of the planning. She said, did you not read their COVID protocols? Because that was a big reason, I guess, why they picked the resort. So
And the resort was Baha Mar.
Yes,
Which is
Baha
a,
Mar.
which is a is it a private island? It's in Nassau, but it's 1,000 acres.
It's in Nassau. It's not a private island. Like Paradise Island is where Atlantis and the Ocean Club are. It's separate from that, but it really is its own little
Resort.
resort
Or
area.
community because it has three different hotels: the Grand
Exactly. Yep.
Hyatt.
So it has the Grand Hyatt, SLS, and the Rosewood. And I mean, they have everything you would ever need. There's no need to leave there. But they have a travel with confidence program. And basically, so they offer 24-hour a day COVID testing. And it's run by one of the hospitals in Nassau. So it's nurses, real nurses and doctors. They have, I'm not sure I think it's an infirmary that's run by nurses and EMTs on the premises. So if you get sick or anything happens, you don't have to necessarily go to one of the hospitals in the Bahamas. They have people on site that can take care of you. Luckily did not get to experience that. And then they also offer, if you do test positive for COVID, they offer 14 days free stay, up to 14 days. They'll test you every day. And then as soon as you test negative, then you can apply to get back into the US. With that, they also offer $150 a day in room service credits per person. Or they offer a private jet back to the US.
And is it anywhere to the U.S. or is it just to
No,
Florida?
it's just to Fort Lauderdale. So they have a partnership or a connection to the CDC liaison in Fort Lauderdale. And if that's the route you want to go, they get into contact with that person and they submit an application to the CDC liaison there. And so that's what I decided.
I mean, it sounds pretty good. I mean, how many people actually get COVID and then go to Baha Mar because they're like, I'm going to get 14 days free. I'm going to get $150 a day. I,
Exactly.
excuse me. So do they make you quarantine? Do they make you stay once you test positive, do they make you stay in a certain room or can you
They
just hang out?
do. So I was with my mom, my sister, and my aunt, and I was the only person that tested positive.
Wow.
And I just don't know how they never got it. And they made us go back to first what happened was we went down, we took our tests. my mom and my aunt got their results emailed to them and I didn't. And I was feeling off the day before, and I had actually taken a home test the night before. I have a reputation in my family for being a hypochondriac, so everyone was dismissing how I felt. And they said, well, we have to get tested anyway to go back to the US, so we'll just get you a test tomorrow.
So was
And
the home test came back negative?
the home test came back, they thought it was negative. I saw a very, very, very faint line. Now, the other thing, and something that maybe your followers would be interested in, is Binax Now, the company that makes the home test, they actually have, it's not the kind that they sell in the store that comes with 2 home tests, but they have a home test that you can do, a special home test that you can do
A
over
video
the
chat.
computer, yep, with a doctor, and they watch you do it, and they give you an official result with a QR code that you can also use for travel. So my sister did that instead of going downstairs at the hotel and getting tested.
And does the hotel charge for the
They
test?
don't. It's complimentary.
Well,
And then because I didn't get my result, I kind of knew what was happening, but I went downstairs and they repeat the rapid test, and that the second one also came back as positive. And so the resort manager came over and spoke with us. We went back up to our room immediately. They stopped, they don't have the cleaning service come in, obviously, and service your room. We were scheduled to leave the next day, and my mom and my sister offered to stay. I said, you should, they weren't feeling sick and they had their negative tests. And I said, you should go home while you can, because if you test positive tomorrow, you won't be able to. So we had to quarantine in the room. We got room service that night. And I had the director of risk management reached out because I had said, we've read your, about your Travel with Confidence program, and I would love to get on a jet back to the US. Not because, the accommodations there were great, but being closed in a room and not being able to leave for up to 14 days, I think I would have gone a little bit crazy.
right. And the balcony, are there balconies? Are the windows open?
We did have a balcony, but we were in a 3-bedroom suite. So I knew, because it was just me, that I was going to be moved. But luckily the concierge that was helping with us the entire time that we were there, she said, I got you a room with a balcony so that you can go outside.
That's nice.
So the accommodations were great, but still being locked in a room.
And there would have been no charge for that.
No charge. Nope.
Wow. But you chose the private jet route, which I can't blame you.
Exactly. I just felt more comfortable being back in the US. And the way it all worked out was great, because we had friends that live in Palm Beach, and half of their family also tested positive for COVID. So they said, we'll pick you up at the Fort Lauderdale airport. You can stay with us. They have a guest house where all the COVID positive, family members were staying. So I could not have lucked out anymore. And so I chose the jet option. I was not the only person on the plane.
Really?
Yep. So I asked after I got the positive result, I asked the resort manager, I said, what's the positivity rate? Because this was right when Omicron was really
spiking.
Exactly. And he said it was less than 1% at that point in time.
I don't know if I believe that.
Yeah. But I was on the plane with 2 other people. So if you do test positive and you choose the plane option, your immediate family members are allowed to come with you. Okay. Again, they just decided to go home we were going to different places anyway. And so they decided to go home. And then I had 2 other people on the flight with me that were COVID positive. And then one of their husbands, who was negative, also was flown back to Fort Lauderdale.
And everyone wearing masks, I assume?
Everyone was wearing masks. Yeah, the resort actually it's a big resort. Everyone was really good about wearing masks inside. Outside, you didn't have to wear masks, and they spaced, all of the chairs on the beach, and they have like 10 different pools, and everything was spaced out. So it felt safe while we were there. The staff obviously is always wearing a mask. And then on the flight back, they gave us N95s. So they had a driver meet us, and they provided us all with like the hospital grade N95s that I use at work. And that's what we wore on the plane.
I see. And the flight, what is 40 minutes from Nassau to Fort
Yeah,
Lauderdale?
30, 40 minutes. It was very fast.
And so what about people who don't live in Florida? I mean, you were lucky that you have friends there and that choose that route. Do they just then get on a commercial jet and then fly back because it's a little bit of a loophole? They don't have to, it's not international. That's what it seems like to me.
Yeah, so I had to provide, when I was talking to the director of risk management, I had to provide the names of the people and the address where I was staying in Florida. And she had said it needs to be a Florida resident. But the other people on my flight, one couple was going to stay at a hotel, and then someone else was going to try and get on a flight. I don't know what ended up happening with
Right.
that.
I mean, so many people, I know so many people right now who are flying with COVID just because they want to be home when they're sick.
I know. Well, we have my plan, if I didn't have friends in Florida, was to rent a car and drive back to Connecticut. Wow. Because I personally, I have a feeling I may have gotten COVID on the flight just based on the timing.
The flight down to the Bahamas.
Yep, just based on when symptoms started and how fast symptoms from Omicron come on. I think that's where I got it. I didn't take my mask off the entire flight. I chugged water right before I got on.
Really?
I had an KN95. I didn't take it off.
And you still think you got it on the flight?
It was definitely that first day. So it was either on the flight or maybe in a restaurant, but we didn't, inside in the restaurants, they weren't very crowded. They had told us at a lot of the restaurants that they were spacing out the timing of reservations, which did make it a little difficult to get reservations for safety reasons, so that the restaurants wouldn't be overcrowded, so that they could space the tables out, and just for safe COVID precautions.
I see. And so would you go back to the Baha Mar?
Oh, 100%.
Okay, that's good. And how were your symptoms? Were you mild?
They were, I'm vaxxed and boosted. I was not asymptomatic. I was pretty sick I felt like I had a really bad cold for 4 days.
Okay. Can I ask you which vaccine you got and when you got boosted?
Sure. I got Pfizer. And because I'm a nurse, I was one of the first people to get boosted. So I got boosted back in October. So I was just at that 10-week mark that they say that with Pfizer, your protection goes down to like 30%. I was really careful. I took the week leading up to the trip off of work because I didn't want to get it at work and then test positive in the Bahamas, which is what happened anyway. I had a PCR before I left to get into the Bahamas, and I home tested myself every day and right before I went to the airport again, so that I wouldn't be in the position that I ended up in, but it all worked out.
So did the Bahamas require a PCR test?
So the Bahamas do not require a PCR. You can do an antigen test. When we left, the requirement was 5 days prior to leaving. While we were there, the Bahamas changed their policy to 72 hours before leaving. Also, the Bahamas, to get your health visa, you also have to buy travel insurance through them, which I think it was like $40 or $60. And included in that, if I had had a pre-existing condition like diabetes or asthma, the Bahamian government would have been the ones to pay for the medical jet back to Florida, not Baha Mar. So the travel insurance that you get through the Bahamas, they cover a air ambulance, is what they call it.
And that was only $40 or $60 for the whole stay?
Yep. And you have to get it to get the travel visa to get into the country anyway.
And they tell you what company that is, by the way, the insurance?
I forget what it is. Okay. I haven't.
Because I work with Allianz, so I was just wondering if it was them. It's okay. Just curious. And then you know, I'm talking to you and you're a nurse, a NICU nurse, are you seeing a uptick in little kids getting COVID and being in the hospital?
No, so we thankfully, we have a lot of moms right now that are testing positive. Thankfully, the majority of them are asymptomatic. And automatically, if a mom tests positive when she gives birth, we offer to the parents to test the baby, and we've had no babies that have come back positive. So our patient population in the NICU, they haven't left the hospital. So they're in the hospital from birth. And we haven't had any COVID patients. A
That's great.
pediatric is a different story of, but for our patient population, it's really remarkable.
And do you feel safe when you're in the hospital?
Yes, yes. Now we have appropriate PPE. Now, in the beginning, it was a little hairy, but and now that I've had COVID, I feel very comfortable.
Like you're ready to travel the world right now.
Exactly, exactly.
So do you know if you can transmit it now that you've gotten it? I mean, I have no idea. I hear different things, so I'm just not sure. Like, if should I be hanging out with my friends that have just recovered from COVID, or could they had the Omicron, or and then you still have to worry about the Delta, or how's that? How does that work? Do you know?
Well, it depends on where you live. In the Northeast, I'm not sure about LA, but in the Northeast, Omicron is basically 100% of the cases now. It's basically annihilated Delta.
And did you have
And
Omicron? Do you know that you had Omicron?
no, I don't, and that is the one thing. When I got back to Florida, I wanted to get a PCR test. I also wanted official documentation in the US that I had COVID just in case I needed it for work. But the Baha Mar actually reported my case because I got a call from the New York Department of Health,
Wow.
just to go over with me, the quarantine regulations and all of that. It was a little tricky because things had just changed from 10 days to 5 days. So it was a little confusing. Um, I personally didn't feel I waited until 10 days and until I was testing negative to get back on a flight back to New York from Florida. Um,
That's good. That's
but
the way it should be.
yes, yeah. So I don't know what variant I had. Based on my symptoms, I'm guessing I had Omicron. And that would have been the one that would be the most likely to have broken through my booster shot. So I'm hopeful. But yes, technically, if I had Delta, I could get Omicron now.
I see. And so, I mean, if you so would you am trying to figure out how to say this, or again, if I'm worried about getting COVID since I have a history of asthma,
Hmm.
but would it be safer for me to hang out with someone who just had it, who just recovered?
I would say yes.
Okay, I'm just curious. Also, I mean, because if I had it, and we were all safe, my family and I would be gone. We'd be just traveling all around. If that's the case, if we,
Are you boosted?
yeah.
Yeah.
But I have a 5-year-old and he's vaxxed, but I have a 2-year-old who's obviously not.
Yep.
So,
Yeah, that's definitely the tricky thing is with kids. With traveling, I recommend, I'm not sure, I'm sure that there is a way to purchase them. But I would recommend getting the medical grade N95s.
we,
Um,
we, we have a KF95 and a KN95.
yep. I don't, if you can get a KN95 is different than an N95 though.
Right.
An N95 is better. So if you can get an N95,
But I hear you have to really like you just can't put an N95 on. You have to, it's like it takes experience, right? They'll put it on correctly.
yes, so we get fit tested at the hospital every year, to test for which size N95. They put like a big thing over our head and they spray this bitter solution. And if we taste it, we have to say something. And then they try a different mask. So, yes, those have to be outfitted by a medical professional. Um, but
Yeah, because just because you're wearing an N95 doesn't mean, if you have it, below your nose or if you just don't have it sealed, it's really not
right.
doing
And
its
so
purpose.
and the same thing with the KN95s. You have to make sure that you're putting it on properly by you pinch at the top of your nose and you go down like this and make sure that there's a good seal. Um,
I see.
and on the airplane, I would recommend taking it off as infrequently as possible.
Right.
Uh,
Well, so we were going to Hawaii and We're supposed to be there right now. I think I said that already. If I didn't, we were supposed to be, and then we're going. We're going to go in a couple months, and I splurged to buy business class tickets. So we have no one really around us. We have maybe two to four people within 6 feet of us,
Yep.
and I have a little portable HEPA filter, which I was going to put in front of my
I think
daughter.
I saw that. I saw that on your Instagram, I think.
Okay, okay, and I was going to give that to her. So, if you were a parent of a 2-year-old, would you put them on a plane?
Yes, I would. I think I would once cases start going down. I think right now they are at their absolute peak.
Right.
So I would, and I think that they're going to cool off in even a week from now. I think we're going to be in a better place.
And today's
So
January 13th, by the way, for anyone who's listening, and it's
yeah,
later down
so
the
I
road.
think February, March, I definitely would, unless hopefully another variant
Yeah,
doesn't come along that quickly.
yeah. Let's
um,
hope it doesn't ever come along again.
exactly. But yes, I would, but I would wait a couple weeks before doing so.
Okay. Well, Meredith, I think we covered everything. Did I miss anything out that you want to add, or and can people follow you somewhere if they're interested in do you have a public
Sure.
Instagram or
Yep.
anything like that?
Yep. Mayor PB. And yeah, this was
How do you
great.
spell that?
That's
MER?
MEREPB.
Okay. And that's on Instagram.
Yes.
All right. Well, we will give you a follow. And again, thank you for taking the time.
Amazing. Thanks so much for having me.
All right. Take care.
Bye bye.